This is Danielle Ryals, and I'm doing my presentation on sex offender legislation. Sex offenders have been chastised for decades, as early as the 1930s, with sexual psychopath laws passed in response to a few high-profile cases and the assumption that they have no control over their sexual impulses and will repeat their crimes again and again, regardless of punishment or other experiences. The labeling of sexual psychopaths carried with it the idea not that only that they were unable to control oneself, but that they were degenerates and sex fiends. Many felt that those labeled with these names needed to be segregated from the population for their illnesses before they committed crimes, preferably, but at least after, until they were cured. Before the sexual psychopath laws was the widespread use of castration. Hypersexuality, as well as the passing on of genetically undesirable traits, was treated through the use of castration in the 1800s. The Nazi regime and its forced castration of sex offenders and other individuals caused the fallout of the practice due mainly for humanitarian concerns. Risk of harm posed by sex offenders allows for the practice of castration to still hold its appeal in communities searching for effective interventions and protection. The high-profile case of Jacob Wetterling's abduction initiated the passage of Jacob Wetterling Act in 1994, creating a centralized database for sex offenders known today as the Registry. The availability of sex offender information to the public followed the passing of Megan's Law in 1996, after the brutal rape and murder of 7-year-old Megan Kanka by her neighbor, a convicted offender. Registration of the offenders quickly became viral information when the Supreme Court ruled that it could be posted on the Internet. Residency restrictions have been enacted in most of the states, regulating the distance sex offenders can live, work, or gather to known locations where young children congregate or attend programs. Restrictions ranging from 1,000 feet to a maximum of 2,500 feet. The zones near schools, beaches, parks, bus stops, and daycare centers are off limits for sex offenders when it comes to housing. Sex Offender Registration and Notification, SORN, is the acronym for the registry and subsequent actions by the state regarding sex offender registry and dissemination of the information. The idea behind SORN was to lessen the ability or urge to reoffend with widespread notification of offender locations. Residency restrictions are leaving sex offenders homeless, reporting false addresses, or shoving them underground, leaving the community with a network of sex offenders that cannot be located. Homelessness is a reality for many in Iowa and South Florida. After the implementation of a 2,000-foot housing zone in Iowa, the number of offenders that cannot be located doubled. In South Florida, many sex offenders were forced to live under bridges due to the abundance of local ordinances of 2,500 feet. Additionally, 245 of the 2,050 offenders registered in Miami absconded and could not be located. Additionally, proximity to children has not shown to affect recidivism rates among offenders. The effects on the offender facing the registry and residency restrictions are far-reaching in their lives, affecting everything from employment to self-worth. Creating a homogeneous group of sex offenders leaves little room for differentiation between minor offenders and sexual psychopaths or pedophiles. This stigmatizes the offender, leading to depression, isolation, increased stress, and hopelessness that is found in 67 to 72% of sex offenders questioned. It is believed that the stigmatization and subsequent ostracizing of the offender could be a mitigating factor in the recidivism rates among sexual offenders. Property damage and personal injury as a result of the sex offender notification is a reality for sex offenders in some states. Policymakers, when asked about the negative effects of the registry and notification, state that they were aware of the vigilantism faced by offenders but felt that the legislation was needed and effective. Human Rights Watch investigations lead to the conclusion that the placement of juveniles on registry has very little correlation with increased public safety, but does create lifelong detriment to the offender. Job loss, college dropout, loss of child custody are just a few things impacted by registry as a sex offender in some cases. Study of juvenile recidivism in the registry show that the inclusion of the registry as a variable does not significantly change the chances of recidivism in juvenile sex offenders. It is the widespread belief that offenders cannot be cured. The overall accepted idea regarding sex offenders and treatment is that the use of treatment methods that are appropriate for the offender can create the ability to control their urges. Replacing the urges with acceptable and appropriate behavior with cognitive therapy is the goal of treatment. Therapy for sex offenders is built on the idea of addressing the behavior and modifying it. There is a consensus that offenders are not cured. However, their behavior can be modified to allow them to deny their urges. Cognitive behavior intervention rests on targeting the variables that create risk. Cognitive behavioral intervention is the most effective treatment for sex offenders. However, other methods like relapse prevention programs are still widely used. The goal of cognitive behavior intervention is altering patterns that were developed and maintained by modeling, observational learning, reinforcement of the behavior or attitude, and cognition. Addressing issues like sexual self-regulation, relationship and intimacy deficits, development of empathy for victims, and triggers allows for the negative patterns to be replaced with non-deviant and pro-social behavior patterns. Castration comes in two forms: physical castration and chemical castration. Physical castration is the removal of the testosterone-producing organs or testes. The removal of the testicles reduces the amount of testosterone in the body, allowing for a lowered sexual drive. Chemical castration involves the use of drugs to diminish the body's production of testosterone. One of the common medicines they use is Depo-Provera. In the study of 40 men with a range of paraphilia from rapists to exhibitionists were given MPA, Depo-Provera, along with psychotherapy, while the control group of offenders only received psychotherapy to test the effects of MPA on recidivism. The results showed the control group receiving only psychotherapy had a higher rate of recidivism of 58% than the MPA group, having only an 18% rate of recidivism. Effectively reducing the recidivism rate among the treatment group is overshadowed by the numerous side effects: abdominal pain, increased blood cortisol levels, depression, diabetes, mellitus, breast milk production, insomnia, gallstones, hot flashes, hypertension, blood clots, headaches, leg cramps, weight gain, and malaise, or the general feeling of discomfort or uneasiness were reported. Chemical castration has been looked at as an effective means to lower the sexual recidivism of offenders. However, only a handful of states have passed legislation for physical and/or chemical castration. Only 4 states take on the financial burden. Physical castration, or the removal of the testicles, known as an archiectomy. Testicles are the primary testosterone manufacturing organ in men. Physical castration will not eliminate the testosterone in men because of the adrenal glands that also produce small amounts of testosterone in males. Physical castration has shown promising results, with recidivism rates below 5%. The irreversibility leaves physical castration for severe and/or voluntary cases. Cases of offender volunteering for physical castration, it is important to note that the state of offense, with the exception of 3 that I was able to find, does not cover the cost for physical castration. Penile plethysmograph is a test administered on convicted sex offenders to determine the specific attraction of the offender by measuring erectile response. The penile plethysmograph measures minute changes in erectile response to sexually stimulating material with the use of a pressure-sensitive device placed on the penis. The results of the tests are used to characterize deviant patterns and aid in the creation of treatment plan, and retesting is used to evaluate effectiveness of treatment. Programs utilize the treatment, and the U.S. courts mandate its use frequently as a term of supervised release. The Ninth District Court, in their response to an appeal, viewed it as intrusive both physically and psychologically. The scientific literature assessing the test observed low accuracy levels, and the true validity of the test is academically controversial. Polygraph testing is used regularly on sex offenders, measuring the heart rate, blood pressure, breathing pattern, and galvanic skin response. The polygraph is thought to identify deception. Changes in the measures used by the test are associated with the fight or flight response caused by fear of being caught lying. The testing allows for the admittance of higher numbers of offenses and generally lowers the self-report amount of personal victimization the offender stated they received. The polygraph, though inadmissible in court, is used to assess the offender's honesty in admission as well as honesty during rehabilitation and supervision. When offenders were asked if they felt the polygraph was effective in their treatment, 6 out of 7 said that yes, it offered more help in rehabilitation. GPS, or Global Positioning Satellite Technology, is used to monitor sex offenders. This as an original creation point leads to the assumption that the majority of sex offenders prey on young children. The reality is that 98% of offenses of young children are by person known to the family. The use of GPS, like the registry, is creating a false sense of security due to the belief that the offender is being monitored 24/7, when in reality there are lags in information and a lack of staff to monitor the reports regularly or in a timely fashion. Recidivism rates of sex offenders are believed among the populace to be great. However, contrary to that belief, the recidivism rates of sex offenders range from 10 to 15 when reviews of studies were conducted in 2005 and again in 2009. The recidivism rates of sex offenders are one of the lowest rates when speaking of sexual-related reoffending. Most recidivism among sex offenders is a non-sexual crime leading to the incarceration of the offender. The only recidivism rate lower than that of a sex offender that sexually recidivates are those of convicted murderers. The stranger danger that society has continually ingrained is posing far more danger by creating ignorance to the reality that 80 to 90% of sexual offenders commit sex crimes against those they know.